Hi guys, so Matt Hancock, the Health Secretary, was in Downing Street on Wednesday to give an update on the current state of the pandemic. He talked about how parts of the country are going to move from one tier into the next tier, and he also talked about how this new variant is facilitating or is responsible for the new cases, the massive number of new cases we're seeing spreading across England. So let's hear what he had to say.
After all the efforts that we've gone through to control this virus, and in many parts of the country, this virus is under control, just as we've got a tiered system in place that was able to control this virus.
No, that's not true. Now, the data doesn't support what Matt Hancock is saying here. Matt Hancock is saying that the tiered system was working and is working. Now, the previous tiered system wasn't working. That's because a lockdown was imposed. Now, this is the data you can find on Google. If you go into Google and you search COVID data UK, you'll find this data. This is freely available. Now, let's look at the timeline. So we'll ignore the first part of the year. Let's focus on the most recent. Now, the tiered system was introduced and it was ended on the 5th of November. So on the 5th of November, after a lot of back and forth between Boris Johnson and Sage and the experts and Keir Starmer, Boris Johnson imposed a lockdown. So on the 5th of November, you can see here how the data, so the cases were leveling off. This was because the tiered system wasn't bringing down the spread. It was limiting the spread, but it wasn't bringing it down. So the second lockdown was imposed. Now, it's important to remember that the lockdown doesn't have an immediate effect. It's not you impose it today and you start to see cases decrease immediately. No, it takes between 7 and 14 days. So let's jump ahead. So from the 5th of November, we go to the 15th of November, 10 days. And you can start to see how the cases are declining. So the second lockdown was imposed and it brought down the spread. You can see it here yourself. It's continually decreasing all the way down here. Now, the second lockdown was ended on the 2nd of December. So you can see here how the cases had been brought down. And on the 2nd of December, the lockdown was ended and England went into the tiered system. Now, what happened here now? The tiered system was introduced and cases started to increase again. Now, Matt Hancock later in this is going to explain how, well, it was because of this new variant. Now, the problem with this idea is that Boris Johnson talked about how this variant was discovered last Friday, which was the 18th of December. But you can clearly see how cases were already increasing. Cases were increasing from, let's see, the 9th of December. So either he didn't know about it and it had been increasing for 9 days before, or the new tiered system is not working. And I fear that they're using this new variant as an cover, as an excuse for the tiered system not working.
We've discovered a new, more contagious virus, a variant that is spreading at a dangerous rate. And I know that the vast majority of people watching today and across the country understand what we need to do together to get through this. And so today we're announcing further action within the tiering system and also some further progress on vaccines and on testing. And I just wanted to say this before I set out the details of what we're going to have to put in place. I know that these actions have consequences. I know how difficult it is, but I also know that it is right to take the action that's necessary to control this virus. Across the country, cases have risen 57% in the last week. The average COVID hospital admissions are 1,909 a day. That's the highest figure since mid-April. There are 18,943 people in hospital with coronavirus right now. That's almost as many as there were at the peak. And yesterday, there were 691 deaths reported. That's 691 people who have died just before Christmas. And our hearts go out to their families, their loved ones, as with all who've died from this horrible disease. I know the pain that this causes. So against this backdrop of rising infections, rising hospitalizations, and rising numbers of people dying from coronavirus, it is absolutely vital that we act. We simply cannot have the kind of Christmas that we all yearn for. Of course, it's the social contact that makes Christmas so special, but it's that social contact that the virus thrives on, and that's how the virus is spread from one person to another. So it's important that we all minimize our social contact as much as is possible this Christmas, and that will help protect ourselves, our loved ones, and the whole country. We've got to keep our resolve. We've got to keep going through this. And there's 4 areas that I want to update you on today very specifically. The first are those tiering decisions that I just mentioned. We know that the 3-tiered system worked to control the old variant.
No, it did not, and I explained it here. It did not control. It limited the spread, but it did not bring down the cases.
Is working now in large parts of the country, especially in Northern England. But we also know that Tier 3 is not enough to control the new variant. This is not a hypothesis, it is a fact, and we've seen it on the ground.
But Tier 3 is not sufficient and to deal with the old variant either. Sage had said on numerous occasions, Tier 3 is not sufficient to deal with the pandemic. You need to have higher restrictions. Now, adding more tiers isn't going to work. You need to impose a lockdown.
We've seen case rates rise in some of the places close to where the current Tier 4 restrictions are. In places like East Anglia, where we've seen a significant number of the new variant, and we've seen case rates rise sharply. It is therefore necessary to put more of the east and southeast of England into Tier 4. We're also taking action in parts of the southwest, where there are some early signs of the new variant and where cases are rising. Even though case rates in some of these areas are not as high as they are in the areas badly affected, in London, for instance, and in Kent, the direction is clear and in many cases quite stark. The doubling times are short. And we have learned that when it comes to being a matter of when, not if we take action, it is better to act sooner.
It's better to act sooner? In the same way that Boris Johnson refused to go into the first lockdown, then he refused to go into the second lockdown? It's better to act sooner? Why? You introduced these new restrictions for Christmas at the very last minute, and you're talking about it's better to act sooner. I fear that what he's doing here is he's seeing that the tiered system is not working. They're trying to avoid another lockdown. Sage and scientists, experts are telling them you need to go into another lockdown. There's no other way to avoid it. Look at the data. You can see how the cases are rising dramatically. But even when the first lockdown was imposed, it was bringing the cases down. As soon as it ended, a few days later, as I said, on the 2nd of December, it ended. Within days, it started to increase again. You can't do this. You have to impose a lockdown. A lockdown will work whether it's the old variant or the new variant. You can't use these tiered systems. They're not going to work. They haven't worked. Now, why is Matt Hancock and Boris Johnson imposing these tiered systems instead of a lockdown? They're doing it for political reasons. They're afraid to piss off voters. They're afraid to piss off their own MPs. Boris Johnson is in serious trouble at the moment because we're getting close to the next vote that he has promised to give Parliament in dealing with this lockdown. And there is growing disquiet, and I think it's going to be quite serious for him after Christmas, because a lot of people are going to be very angry. A lot of people are angry with their MPs. Businesses are very concerned. Many businesses had hoped to reopen just before Christmas to take advantage of that reopening, but that's not the case now. There many companies and restaurants, bars, restaurants, pubs are likely to close for good. They're not going to be able to recover. They were hoping that there wouldn't be another lockdown, but the writing is on the wall. There is no way to avoid it. I know that Boris Johnson and Matt Hancock want to try to blame something else, but they can't get away from the fact that the tiered system is not working. It's not strict enough. Adding more tiers is not going to work. You need to have a proper lockdown. You need to keep people in their homes until the cases, and I'm not saying to put people in their homes for 6 months. I'm talking about put people in their homes, restrict their access, restrict their movements for the time required to bring the cases way down, implement a real test, trace and isolate, not some Serco corrupt version of it. Impose a true one that will work, and it will bring down the cases. And then you're able to manage any variant. And even if there is a new variant, you're able to manage it. And then you have the vaccine as well. The vaccine is going to pick up the slack there. Now, I hope I'm wrong. I hope that the tiered system is working. I hope that it's due to this new variant that the cases are rising, and not because the tiered system is broken. I truly hope I'm wrong, but when I look at the data, I'm convinced otherwise. Guys, you look at the data, you look at what Matt Hancock is saying, and tell me what you think. As always, your comments are greatly appreciated. Thanks a lot. I want to say a big thank you to all of my patrons. You ensure that this channel continues to exist. I'm eternally grateful for all of your support. If you join Patreon, you will receive instant access to our Discord server, where we have both audio and video chats. You can chat with me and other patrons, where we discuss important and non-important issues. Becoming a patron per month costs about the same as a large coffee, so why not check it out?